Vitamins are essential to life, but in today's supplement-saturated culture, they are often treated as risk-free, universally beneficial, and impossible to overdo. That assumption is not only wrong, it can be dangerous. The phenomenon known as hypervitaminosis, or vitamin toxicity, is a growing concern, particularly in aging populations and among cancer survivors who turn to high-dose supplements in hopes of improving recovery, boosting immunity, or preventing recurrence. And while the risks of water-soluble vitamins like C and B-complex are usually minimal, excess amounts are typically excreted. Fat-soluble vitamins, A, D, E, and K, behave very differently in the body. When taken in excess, they accumulate, and their effects can shift from therapeutic to toxic. Take vitamin A, for example. At modest levels, it supports vision, immune function, and cell growth. But at high doses, especially from supplements, not food, it can cause liver damage, bone loss, hair thinning, and even neurological symptoms like headache and blurred vision. In pregnant women, excess vitamin A is linked to birth defects. Among cancer survivors, who may already have compromised liver function from treatment or surgery, the risks of toxicity may be even more pronounced. Yet many over-the-counter multivitamins still contain retinol, preformed vitamin A, well above the daily recommended levels, and patients often combine these with other immune boosters without realizing they're overdosing. Vitamin D, long praised for its role in bone health and immune modulation, is another example of how more is not always better. In recent years, high-dose vitamin D supplementation has been aggressively promoted, especially to older adults and people with chronic illnesses, including cancer. But vitamin D toxicity, while less common than A, is very real. It can lead to dangerously high calcium levels in the blood, hypercalcemia, resulting in nausea, vomiting, confusion, kidney damage, and cardiac issues. The threshold for harm varies by individual, but toxicity has been documented even in people taking so-called immune support stacks under the assumption that vitamin D is inherently safe at any dose. Vitamin E also poses risks. High-dose supplementation, especially above 400 IU per day, has been associated with an increased risk of hemorrhagic stroke. It can also interfere with blood clotting and interact negatively with anticoagulant medications, an especially relevant concern for older adults or those with cancer-related vascular complications. Despite these risks, many supplements marketed for skin, anti-aging, or immune health contain excessive amounts of vitamin E, encouraging long-term use without any medical evaluation. Vitamin K toxicity is less well understood but can still create problems, especially when combined with blood-thinning medications like warfarin. While food-based sources of vitamin K are typically safe and important, concentrated supplements can alter coagulation dynamics in unpredictable ways. Again, the risks are magnified in populations dealing with multiple medications, chronic illness, or post-cancer treatment regimens. One of the most alarming aspects of hypervitaminosis is that symptoms often develop slowly and are nonspecific: fatigue, irritability, gastrointestinal upset, or joint pain, which means toxicity can go unnoticed for weeks or months. During that time, organs may be under silent assault. The damage may not be reversible, and in some cases, particularly with liver or kidney involvement, it can be life-threatening. The supplement industry, largely unregulated in many countries, contributes heavily to this problem. Products are often marketed as natural, harmless, and necessary, particularly for aging adults or cancer survivors looking to regain control over their health. But without lab monitoring, medical supervision, or awareness of drug interactions, these natural solutions can quietly become a toxic burden. Medical oversight is essential. For cancer survivors, whose nutritional needs are often altered by treatment and whose organs may be more vulnerable to overload, indiscriminate supplementation is risky. For older adults, whose metabolism, absorption, and kidney function may be diminished, the margin between helpful and harmful shrinks even further. Blood tests, dietary assessments, and personalized care are not luxuries. They are safeguards. The bottom line is simple but often overlooked. Essential does not mean harmless, and natural does not mean safe. Vitamins are powerful biological agents. They should be respected, not assumed benign. When used wisely under supervision, they can support recovery and health. But when taken in excess, especially without medical guidance, they can quietly turn into poisons. In a world obsessed with health optimization, hypervitaminosis is the shadow few are watching. And it's growing.